Hey everybody, it's your man mother of the internet with another news story for you. I know there have been TikTok videos floating around, stories about furloughs and layoffs as far as the healthcare industry is concerned, cuts in hours in hospitals and stuff, and people are wondering what the hell is going on. Well, the Politico has it covered to a certain extent. I did pick out a lot of the facts and stuff, and we're going to go over the facts in the video. So let's go ahead and roll the intro and get to it. Healthcare workers are facing threats to their jobs. We've seen that on Twitter, if you guys are on Twitter and following that, and other social media as well that have been sharing news stories. Pay cuts, furloughs, and even layoffs, we've heard about those, amidst the worst disease outbreak in a century that has already infected more than 770,000 people in the U.S. alone. Hospitals are focused on combating the coronavirus, as you should when there's a pandemic around there and there's no cure or vaccine. But that's not where the money is. Medical practice and patients themselves are postponing elective procedures, not to mention some states have postponed those elective procedures due to their shelter-in-place restrictions. And delaying routine visits that usually drive profits. You know, wellness checks, preventative checks, things of that nature. Plummeting revenue, compounded by higher costs for supplies like personal protective equipment, has led healthcare executives to take drastic steps by cutting payroll to try to keep their lights on as they fight the pandemic. Now, as we know, there are some hospitals that are overstretched. And they're stretched to the limit because they have an overabundance of corona patients taking up ICU and things like that. The Trump administration last month urged providers around the country to shut down a huge portion of care services in anticipation of an influx of coronavirus patients that wasn't as bad as forecasted in some areas. In other words, some of the forecasts were inaccurate, or the forecasts were pretty reasonable. They weren't going to be overtaxing anything, and Trump made the mistake of saying, hey, you need to do this instead because, you know, you're going to be hit, sort of ignoring forecasts. It's something he tends to do. He shouldn't. I mean, you know, there are professionals that have forecasted this and can pretty much tell region by region, state by state, so on and so forth, how bad an outbreak is going to be. And sometimes he thinks he knows more than everybody else when he really doesn't. That's the egotist part of him that I can't fucking stand worth a crap. That left some healthcare workers who aren't involved with direct COVID-19 care without much to do, and prompted executives to lean on furloughs or pay cuts. And that's where they came in, to maximize budgets, because you always have to protect the bottom line. Cold, bitchy sounding, but when you're running a hospital, you do have to make sure that you're running enough profits in order to pay all the overhead that a hospital creates. Some employees were able to move to other areas within their hospital or health system to fill in where they were needed, but not everyone could do that. Specialists and the like were probably the ones that couldn't do that. Congress sought to help, allocating $100 billion for hospitals as part of its stimulus rescue package, amidst a lot of arguing between the Democrats and the Republicans, but we're not going to get into that in this one. But that didn't reach all parts of the healthcare system. Plus, hospitals didn't have to spend the money on staffing. So there weren't restrictions on the money that these hospitals got and where or how they had to spend the money, so they focused it on what it needed to be focused on, which a lot of times isn't payroll and keeping people paid. The turmoil over healthcare jobs is unprecedented, of course, as the industry historically has been largely protected from economic downturns. You always need to go to a doctor. You always need to have a procedure, or at least have a checkup done. So it's always something that you need to go see a doctor for one reason or another. In fact, healthcare is usually a job generator that helps recovery. You know, in the Great Recession, the industry continued to create positions even as the rest of the economy shed millions, adding more than 850,000 between 2007 and 2010, while the overall economy lost nearly 8 million, according to the Bureau of Labor Statistics, which is also the Census Bureau. That's where you get all that information from. Tens of thousands of healthcare workers who aren't caring for coronavirus patients have already been laid off, and experts warn that that number could multiply. Sad to hear. It's really scary to hear. The issue now is the extent of the damage and how long it will last. There is no comprehensive data that illustrates how broad the effects of the on the healthcare industry have been, but by all measures, the damage appears to be extensive. The Department of Labor's March jobs report showed a loss of nearly 43,000 health positions. Ouch. The sector's worst month in at least 3 decades. And those numbers are from mid-March, before most closures and stay-at-home orders took effect. So there you go. It's pretty much a catch-22 situation in hospitals, because the nurses and stuff you can usually shuffle from department to department. But when you have some people that specialize in just certain niches, those don't become essential when all you're doing in that hospital is treating and getting ready to intake mass numbers of people suffering from the coronavirus. So you have that problem. And so the dilemma becomes, do we keep these people in these hospitals with their regular hours and pay them, or do we cut their hours? Do we furlough them? Do we lay them off until this is over? So this is why you see, this is my theory of why you see, TikTok videos circulating around Twitter with people bitching, when you have the healthcare workers in the hallways doing, the dances and the silly junk and all that stuff. Am I going to shame them for doing that? No. No. I'll let the people that don't understand how stressful healthcare work can actually be shame them. You need to have some sort of morale booster. You need to have some sort of goofy moments to keep the stress down when you're dealing with a pandemic that you have no proven effective treatments for, and you have no vaccine for, so you can actually keep the rest of the population from getting sick. Now, as far as the empty hospitals are concerned and the reports that are coming out into the media from mainstream, I hope this particular article explains it, because when you cut out all quote-unquote non-essential elective surgeries, procedures, and non-essential visits to the doctor, you're cutting out most of what people go to the doctor or go to hospitals or healthcare centers for. I mean, let's face it. You have a cough on a regular basis, and it's a nagging cough and it doesn't go away, you go see a doctor. If you have allergies, you go see a doctor. For these particular elective surgeries and elective visits. If you're into preventative care, you already have a whole line of doctor's visits and consults lined up that would be considered non-essential in the case of a pandemic. So all of these procedures, they had to cancel. They had to cancel all of these doctor's visits. My mom lives in Minnesota. She has had breathing problems for the past quite a few years now. She's in a high risk, she's in the high risk bracket for corona. And she has to get consults from her doctor over the phone. And her doctor have already joked about how we're going to do blood tests through the phone. How you're going to check my blood pressure through the phone. How you're going to listen to my chest through the phone. These are all things they're goofing off with, but it's absolutely, you don't think about these things until you can't do them. And then it's like, okay, how dumb is it to try and diagnose somebody with a breathing problem when you can't be there to listen to them breathe? It's just things like that. And there's another news vid in the can. If you liked the video, well, that's what the thumbs up button is for. If you didn't agree with it or you had some issues with it, well, there's that other button that we don't talk about. And next to those buttons is a bright red button if you haven't subscribed to the channel. I'm not going to give you instructions on how to use it, but if you decide to subscribe, you know how to use it. And don't forget to hit the bell, even though that bell is as fickle as a pregnant woman in a grocery store that has skipped a meal recently. Yeah. Here's my Instagram, here's my Twitter, and here's my blog that I'm dusting off and getting ready to start writing stuff on again. Also, too, I am still keeping up with state openings and that, so you can DM me on any of those. Or you can post it on the community tab here, because I am going to be posting updates on there as well. There are several ways of supporting this channel. All of them are located in the description, along with the Politico article I just read. Sorry for the lack of English. Until next time, guys, stay calm, stay informed, stay safe, and I'll see you next time.